Best described by Donald Smith, Dean Emeritus of Cornell University's College of Veterinary Medicine, as a scholar, surgeon, and healer, George E. Reed, DVM, MD, devoted over 60 years to the practice of healthcare and philanthropy. A physician in the Oslerian tradition, his hands, mind, and heart would be imprinted upon thousands of patients, either directly or through the physicians he trained to follow those principles he taught and embodied. Born in 1923, he entered Cornell as recipient of a tuition scholarship intent on becoming an engineer. He received a doctorate in veterinary medicine in 1944 and was discharged from the Army Specialized Training Program. He waived deferment from the draft and enlisted in the Army as a private. After completing basic training, he was transferred to Field Artillery OCS, but was commissioned a first lieutenant in the Veterinary Corps. In 1947, he was separated from the Army as a captain after establishing a successful school for veterinary technicians in the 5th Army. That fall, he entered the NYU Bellevue College of Medicine, from which he received his MD degree in 1951. His surgical residency was completed in 1956, at which time he was appointed Fellow in Surgery, with a modest fund and a mandate to establish a large animal surgical laboratory in which to develop an open heart surgery program. The first operation in April 1959 led to one of the most successful programs in New York. His appointment as cardiac surgeon for Bellevue's Thursday night clinic, the first of its kind, assured patients free surgical care without sacrificing their daily wages. As cardiac surgeon for Irvington House, one of the earliest free centers for treating children with rheumatic fever before artificial heart valves were available, he was successful in developing techniques for repairing valves with autologous and cryoconserved tissues, techniques available for adults as well. The large animal surgical laboratory pursued an early interest in the support of the failing myocardium as the result of changes in the metabolism, mechanical support of the left ventricle, the successful protocol for counterpulsation, transmission of electrical energy through the intact skin to energize ventricular assistance while avoiding infection, techniques for repair of cardiac valves, and preservation and use of autologous tissue before mechanical valves were available. Of special interest and success was coronary artery bypass grafting utilizing both internal mammary arteries. The use of magnification with binocular loops was introduced and popularized. Dr. Reed served at NYU Bellevue as professor of surgery, chief of cardiac surgery, and director of the Surgical Research Laboratory. In 1977, the HSA designated a newly built Westchester Medical Center as a tertiary care hospital for the Mid-Hudson Valley. Dr. Reed was recruited to establish a cardiac surgical service to serve this 7-county area with a population of 3 million. This rapidly became one of the busiest cardiac surgical services in the state because it operated on all patients who could benefit from surgery regardless of ability to pay or severity of disease. At Westchester, he served as a professor of surgery, chief of cardiac surgery, and vice dean of New York Medical College. The last 12 years were spent as medical director of this 1,000-bed public medical center, as vice dean of the medical college, 2 positions for which he declined compensation to avoid the possible conflict of interest as medical director with his position as president of the Medical Faculty Health Alliance, the full-time staff and faculty organization which he was instrumental in founding. Altruistic goals were evident from the beginnings of his career. His training, followed by surgical practice and teaching, was primarily in public hospitals such as Bellevue Hospital and Westchester County Medical Center, where he had continuing exposure to poverty in healthcare. When he became aware of the inability of trained cardiac surgeons to establish programs in their home countries because of the lack of infrastructure, he invited those surgeons to bring the components of an open-heart team to Westchester for 1 or more months of one-on-one training in the pre- and post-op cardiac units and as spectators in the OR. After this intensive training, they returned home with instructions to duplicate the infrastructure and to select 24 patients suitable for operation. A Westchester team, who volunteered and waived their vacation time, was then sent for 2-week periods. The operations and post-op care were performed entirely by the local team, visitors providing only consultations with no hands-on participation. Meticulous selection and exquisite post-op care resulted in almost 100% survival and the momentum to go forward with positive anticipation. This program, or a close variation, was used in Greece, Albania, Armenia, Slovakia, Ukraine, Thailand, Borneo, Bangladesh, Pakistan, Beijing, Xi'an, Nanning, Kunming, and Shanghai. An offshoot of this program was used by Dr. Saw Huat Song of Singapore to provide the same assistance to other hospitals in China and Southeast Asia.